All right, good afternoon. My name is Terri Moncrief. I'm a firefighter paramedic with the City of Forest Park. I have been a part of the department for close to 12 years now. The pandemic has hit every community rather hard, disproportionately in some communities. We've seen a sharp uptick in cases of COVID in our area. And with the advent of the vaccine, I thought it might be a good idea to bring in an expert or two to discuss what the vaccine is, its abilities, what's in it, any side effects, and try to dispel some of the misinformation that is pretty rampant on social media. So today our goal is to answer as many questions as we can with regards to this new vaccine and try to ease some of the worries that a lot of people have about it. With me today, I have Dr. Terri Moncrief. She's an allergist and immunologist from the Dayton, Ohio area. She studied at Cincinnati Children's and is currently a partner at Allergy and Asthma Center of Dayton. Mm-hmm. She has been following the virus closely, and with the creation of the vaccine, has been following that as well. She will provide us with the numbers, the general information of what's going on, what to expect from the vaccine, and will help further our goal of easing people's worries about getting the vaccine. Thank you for being here.
Well, thank you for having me. I'm glad to have this opportunity to hopefully dispel some of the rumors that are out there.
All right. Also with us is Chief Alfonso Jones from the Forest Park Fire Department. He has been with the city since 1992. He's here to discuss his personal change of heart when it came to the vaccine and what has led him to get to where he is today. With that being said, Chief, thanks for being here.
Thank you, Eric, for having me, and I'm pleased to be here to try and assist you in debunking the myths that are out there, so I appreciate it.
Well, good. To start, we're going to start with Dr. Moncrief because she's the one here that actually knows all this stuff. When it comes to COVID, can you just give us a brief intro of how it spread, why it hit our country so hard, and what some of the risk factors from having an adverse reaction to the actual virus may be?
Mm-hmm. So that's a great place to start. Coronavirus is the name for a set of viruses that are actually not new. There have been many different strains of coronavirus. The novelty of this virus is that this particular strain has not circulated in any population, which means that there is no immunity, no natural immunity in the community. When a new virus like that comes out, what can happen is it could sweep through nations very quickly, as we've seen, and make people very ill. So you've probably heard of SARS outbreaks in China, in other parts of Asia, also in the Middle East. But we've not seen a SARS outbreak here in the United States. So coronavirus by itself is not new, but this particular strain is new, and it's more severe in the illness that it can cause. So you might say, well, gosh, if this has been around for so long, why are we so frightened about this illness? And isn't it just the flu, which is what we see on social media, what a lot of my patients are saying, well, this is just the flu, I get the flu, I got better, I was sick for 3 or 4 days, maybe a week. This virus is very different, and as a healthcare provider, it's pretty daunting. So this virus will infect not just the upper respiratory tract, which can happen if you have the common cold or some of the milder coronaviruses, where you'll get nasal congestion, sneezing, low-grade fever, some fatigue that lasts for a few days, but this actually can go down into the lower airways, into the lungs. So one of the cardinal features of coronavirus, the novel coronavirus, COVID-19, is that it can cause shortness of breath, which can be at times severe. It can cause what we call paroxysms or fits of coughing, where you cough so hard and so badly that your oxygen saturation can drop, and that can be very dangerous. Coronavirus, the new novel coronavirus that we're experiencing, can cause all sorts of other symptoms that can be very dangerous. High fever, diarrhea, body aches, And many people who are being hospitalized are going into respiratory distress, which can ultimately lead to death. So this is a severe version of a virus that has been seen, and in that it's new. When it first started to circulate, there were really no treatments, and we were starting at square one. So that was what frightened the medical community so much.
Now, with it being new, and with the numbers we've seen worldwide, would it be fair to say that this virus is more contagious than, say, the flu or the SARS virus?
It is more contagious than influenza and also more deadly. So one of the pushbacks that I get from patients is that, well, we have people that die from the flu every year. In a typical flu season, we'll see between 40,000 and 60,000 deaths in a 12-month period. And flu season is usually between December, a late flu season will start in February or March. But with the novel coronavirus that we're seeing, we've already had 400,000 deaths in this country. So it's a lot more severe than the flu.
And our first reported cases were, they're looking back maybe February of 2019?
Very end of January, beginning of February, yes.
So 400,000 in roughly 10 months.
Correct.
So we're on average getting a month what one flu season will give us in a year.
Absolutely.
Okay. So it's more contagious. So what groups are disproportionately more affected or more likely to have a severe reaction to catching COVID-19?
So you're more likely to catch COVID-19 if you're around a large group of folks, if you are public-facing, forward-facing in your line of work. So those people who were not able to work from home when this pandemic first started were at increased risk. Those people who worked in grocery stores, those people who worked in the supply chain, first responders, of course, were at increased risk, police officers, firemen, firefighters, I think I'm supposed to say now.
That is correct.
Also teachers, people who see the public, medical professionals, so doctors, nurses, medical assistants, the people who clean up in the hospitals, are at increased risk of catching it. Doesn't mean they're more susceptible, but they're around more people, so that increases the risk. There are groups of people that are at increased risk of having severe disease. Those are people who generally have poorer health to begin with. So people who have hypertension, high blood pressure, are having worse outcomes, and that is very common in certain populations. People with diabetes or other chronic health conditions are having a more difficult time with coronavirus, SARS-CoV-2, which is COVID-19. People who have mental disabilities are also having poorer outcomes. There are certain racial and ethnic communities that are having a more difficult time as well. So the African American community is disproportionately having morbidity or severe illness and death, and that is multifactorial. It has to do with the baseline health of the population. It also has to do with the access to a provider that you trust, access to health care, increased rates of obesity, which is another risk factor for difficulty handling the disease, hypertension, diabetes, and so forth. Gotcha.
Now, when this first hit, I remember Italy was ravaged by the virus. From some of the things I heard, and I don't know if it's true, a lot of it was attributed because it's a high smoking population. So they smoke a lot. It's a virus that attacks the lungs. It makes sense that you're going to have higher incidences of death and poorer outcomes. When it got to the States, we're not as much of a smoking population as maybe we were 20, 30 years ago. Why is it hitting us so hard?
Well, when this first started in the major metropolitan areas, so in big cities in Italy and other countries in Europe, like in Brazil, if you think about it, our biggest scare occurred in New York City. And I think that had to do a lot with population density. So when this was happening in March and April in New York City, my colleagues and I were talking about how little we were seeing in the Dayton, Ohio area. And in the back of my mind, I thought, just wait, we'll get our turn. So Viruses that are transmitted through respiratory droplets from close contact interactions, really it's looking for another body, okay? So the closer bodies are to each other, the more likely they are to transmit the illness. So it hit a large city, and then it just trickles into the rest of society. So I think it had to do with population density to begin with. I think that's also why a lot of the Latino community is having higher rates of infection, is because multi-generational living is very common in that population. So if there's more people in a household, there's more people that you can infect.
Okay. Now, before we start getting into the vaccine, you hear wear a mask, wear a mask, wear a mask.
Yes.
I hear other people say masks don't work. So there's all this information, a lot of it from non-scientists saying masks don't work. What does the mask actually do? Does it matter the kind of mask? With there being a shortage at one point, they're saying any facial covering. What does a mask actually provide if you take two people, one person that has it, one person that doesn't, that come in close contact with one another? If they both wear masks, if one does, one doesn't, if neither one does, what are we looking at in terms of transmission rates with wearing a mask versus not wearing a mask?
So masks are actually very helpful if worn properly. So the wearing of the mask is important, but you have to wear it over both your mouth and your nose. So what the mask does is it stops those respiratory droplets that we normally expel just talking from traveling as far. So they did a lot of studies at the beginning of the pandemic to try to prove the effectiveness of wearing a mask, where they would have a person cough or sneeze without a mask on. The respiratory droplets will make it about 6 feet before they start to drop pretty quickly. And that's where you get the 6 feet of social distancing recommendation. Now, my mask is keeping my droplets to myself. Your mask is keeping your droplets to yourself. So if you think about it, if I have on a mask but you don't, and I cough, it will protect you about halfway, okay? So my droplets won't go as far, but you also have the ability to breathe in. Mm-hmm. So if everyone wears the mask, it significantly decreases how far the droplets are making it between the two of us. Okay. Now, are there different types of masks that work better? Yes. At the beginning, when personal protective equipment or PPE was scarce, we said, wear anything. Wear a bandana, cover your face. Wear one of those neck gaiters, cover your face. Wear a cloth mask that you make at home. There are tiers to which types of masks are most effective. At the top of that tier is the N95 mask, which means that it filters out nanoparticles from the environment, and it is not going to allow virus particles to come out or virus particles to come in. That's the highest protection, but the hardest to get and the most expensive. Right under that are the paper surgical masks that you see surgeons wear all day, every day, and nurses that are in surgical suites. That's kind of second tier, okay? Pretty good about keeping respiratory droplets contained. Beneath that comes a cloth mask, so the masks that people are wearing and making at home, or those that we're purchasing, the soft masks from stores. And then beneath that are cloth gaiters that people are wearing over their necks. Those are a bit thinner, and the weaving is not quite as tight, so they're not as effective at keeping those droplets down, but they do help some.
Because the virus itself is a particular size.
Correct.
So an N95 mask will filter out something that size, whereas a cloth neck gaiter, which I've worn,
right,
might not have the weaving, like you said, tight enough to keep the particle from coming out.
Absolutely.
Okay. So say, hand washing, social distancing, wear a mask, everyone slips up somewhere, and say you are someone that gets the virus and you are at risk for having a potentially very bad outcome, whether it is high blood pressure, obesity, or smoker, whatever the long list is.
Yes. Is
there a approved treatment to help expedite the virus and get it out of your system and give you a better outcome? I'm
glad you asked that. They're approved by the FDA. There are actually no FDA-approved treatments for coronavirus. There are treatments, however, that have undergone what's called emergency use authorization, or EUA, by the FDA. And what that is because of the great need that we have and the urgent need that we had, the FDA is reviewing treatments in a more expedited manner in order to get treatments out that are showing promise. There are what are called monoclonal antibodies, which are laboratory-made antibodies, much in the same way that your body's immune system makes antibodies to fight infection. They're proteins that go after infection and neutralize them. And that's how your body naturally fights an infection. Well, very smart scientists have been making monoclonal antibodies for all sorts of illnesses for decades. That are used, I use daily in practice. However, some of these scientists have been able to make an antibody that has been shown to neutralize the coronavirus illness. If taken early, can decrease the severity of illness and can decrease the likelihood of a person being hospitalized. Well, that's huge. Mm-hmm. But it had to undergo that emergency use authorization. So are there any FDA approved? No, but there are treatments. The important part about this is to make sure that the community knows to call your doctor if you think you have coronavirus and to get tested. So this is very similar to a person that has influenza. So you might have heard, if I can get Tamiflu started within 4 days or within 48 hours, it will shorten the duration of my illness. A lot of people have heard of Tamiflu. Mm-hmm. Well, very similarly, there's a one-time infusion that if you start within 10 days of getting a coronavirus diagnosis, it can decrease the severity of your illness.
Okay. Now, Chief Jones, we were both working early on when this pandemic started. And I don't know about you, I fell victim to a lot of misinformation. I went down a lot of rabbit holes on social media, and I was starting to listen to people that were non-scientists. So we were hearing things like, just wash your hands, you're fine. It's no worse than the flu. And if you look at our run volume, that first wave that hit March, how badly affected were we in terms of run volume? How much did we see in the city of Forest Park?
Well, actually, at the beginning of when we start seeing the coronavirus hitting the United States, our run volumes actually took a dive. I believe because this is just an assumption that people were afraid to go to the hospital because usually hospitals are taboo and there's you'll die when you go to the hospital, you get some kind of sickness from being there. So our numbers actually dropped off. But as we started moving closer to the summertime, we did start seeing more and more COVID type of responses, especially in our nursing care facilities. And then we started seeing in our communal living locations. So we definitely did see that spike up. So yes.
And so as someone that, works every third day, I personally have noticed a huge spike. It's probably end of summer, August, moving forward. Well, you're right. When it dropped off in the beginning of the spring, we were making 1 or 2 runs in a 24-hour period. It was kind of nice. You get to go home rested. But once the end of summer hit, it felt like the people that were calling for COVID were way worse off. Because the ones we had initially were isolated to the nursing home, like you said. That was, I think, at one point it accounted for 20% of the deaths in Hamilton County. But then we kind of hit a lull, but then we started seeing the numbers uptick. And me personally, I know taking people to the hospital, whereas before they thought they had it, we could walk them at least out to the stretcher. These people we were having to carry out. Sweating, fevers, body aches, unable to walk, severe cough. You could hear them wheezing. So it's definitely made its rounds, like Dr. Moncrief said, where it started in New York and hit that densely populated area. And she said, well, just wait. It finally came. And so we're still seeing it now where people are getting sick and whatnot. So I know it's changed my thinking on the whole virus. And now that we know what it is, we have chosen to, everyone believe scientists and doctors that they know better. I know that. Okay. That the question now becomes, we know what the virus is. We know how to limit transmission. They have come up with a vaccine. And this is the new hurdle we have to get over as a society and as a minority community to get people to accept the vaccine for what it is. So Dr. Moncrief, why do you feel we need the vaccine?
Well, not only is it a severe illness that is causing death, I know it sounds like it's not terrible when the death rate is, less than 2%. I think it's 1.6% now is the death rate. So your likelihood of dying seems very low. However, if we let this infect the entire population of the country, or even close to that to get to herd immunity, we're talking millions of deaths, like 5 million deaths. And as a physician and someone interested in public health, there's no way we can accept that lying down, okay? But if you survive, it does not mean that you go unscathed. So, for instance, this virus, you may have heard that there are long haulers. There are people that get the illness, they get over the initial illness, but they have chronic symptoms. And these chronic symptoms include chronic shortness of breath with permanent, what looks to be like permanent lung damage. There are people that are having neurologic symptoms, insomnia. There are children that have asymptomatic coronavirus who are being hospitalized with heart and kidney failure of unknown cause. So you may survive it, but there's no guarantee that you will survive it unscathed. So I think it is necessary for us to have a vaccine for those reasons.
Right, and the virus itself doesn't discriminate.
Oh,
it can get
absolutely
anybody.
not.
Young, old, male, female,
Absolutely.
doesn't matter your race. You can be a healthy person, though an unhealthy person is more likely to have a negative outcome. Anyone is a potential victim of this virus.
Absolutely.
So for me, I just got my second round of the virus vaccine today.
Very good.
And my fear was possibly doing what I do for a living and giving it to family members. I live with, there's people in my life that are immunocompromised. I just knew I couldn't live with myself if I gave it to one of them. Plus, I didn't want, like my personal doctor, I had a virtual meeting with him, and he was out of breath during the meeting. He said he had it a month ago. He can't even walk up a flight of stairs, and he's maybe 48, 49 years old,
Right.
and he's healthy. He's not he's not type 2 diabetic. He doesn't have any of these other issues. He's a healthy man that works out regularly. He now can't do more than 2 jumping jacks without doubling over. Yeah. So I know personally I wanted to avoid those things. The vaccine itself has been just this mystery to a lot of people. And with that mystery and its fast creation and deployment has created a lot of areas for misinformation. Mm-hmm. So first I want to talk about fast, the speed. Mm-hmm. I mean, most vaccines take a decade to get approved, years.
Years.
To say? Okay, so years. Mm-hmm. This one, it felt like it was just a matter of months. Mm-hmm. Why is that?
Well, I think there are a couple of reasons. First, I'd like to start by acknowledging that there is good reason for mistrust in medicine, especially where the minority community is involved. Because historically, there have been ways in which minority communities have been used or mistreated or experimented upon, all for the sake of medicine and healthcare. So I don't want to fail to acknowledge that, because that is real. But what we do need to acknowledge is that in this particular instance, this vaccine took advantage of a technology that scientists have been studying for 10 years. So you may hear the word mRNA. This is an mRNA vaccine. We've never had an mRNA vaccine. That is true. But this technology has been investigated for quite some time. Okay. Also, researchers will tell you that the biggest time-consuming portions of vaccine and medication development is funding. So what was different in this case is that instead of having a research proposal, an idea, having to petition the government for a grant or for money, waiting to hear that answer for months, getting the money, then putting the studies in motion, doing the first phase, presenting the information, petitioning again for more money, waiting for months to get that answer, and so on and so forth through 3 phases in production. Millions of dollars was funneled into the research and collaboration for scientists to get this done as quickly as they could. So money was not an issue. Mm-hmm. Resources in this case was not an issue. The other thing is the population has, this is the product of necessity. So if you think about it, if there's something that is pressing in your life, you figure out a way to make it happen, okay? So the scientists were highly motivated, and the population volunteered. Those people who volunteered to do the phase 1, 2, and 3 trials, tens of thousands of people were ready to do what they could to promote science. And so I will tell you, reading everything I can get my hands on about this vaccine and its production, none of the 3 phases that are needed for vaccine development were skipped. They were all 3 done. Then this information was presented to the FDA, and the FDA hearings are public knowledge, public documented and recorded, so you can listen to them yourself. So the FDA rigorously reviewed the studies and again underwent this emergency use authorization. So instead of taking their time to approve the vaccine in the time course that it typically would take, because there was an urgent need and the studies looked very promising with reasonable side effect outcomes, they were then able to release with confidence this vaccine or these 2 vaccines to the population.
So the normal obstacles and the things that normally slow down the production of a new drug or vaccine, you have to get government approval.
Absolutely.
You have to have enough money for it, and you have to have enough people to be a part of the trial.
Correct.
And all 3 of those phases, the 3 biggest obstacles or hurdles that have to be overcome, were all done in a matter of weeks because of the demand, of the need to create something to save lives.
Absolutely. Months.
Months.
Mm-hmm.
So instead of years, we had months. So that explains why this is so fast. Mm-hmm. Now, the amount of people there, the tens of thousands that were in these studies, how many does a normal study get if it's drug ABC that wants to come out? How many people might they get in the study of that?
About the same.
So the same amount of people that would sign up for a normal development of a vaccine or a drug signed up for this, they just did it exponentially faster.
Absolutely. And the other thing that did help to facilitate the vaccine coming out quickly is the vaccine manufacturers began manufacturing the vaccine, meaning making it, before they got the emergency use authorization. So for those of us that are following all of the companies that are making vaccines, there's been a company that had to scrap their medication, the vaccine, because it did not meet the requirements. So again, after the phase 3 trial was completed and the emergency use authorization was given, the vaccine was ready to be shipped. So then it's just a logistics issue.
So when the dust settled, there were 2 companies that were approved by the FDA does the approval?
Correct.
What were the 2 companies?
There's Pfizer and its European counterpart BioNTech and Moderna.
Moderna and Pfizer.
Yeah.
And you're not on payroll for either one of those,
No,
right?
I wish.
Oh, okay.
No.
So Moderna and Pfizer both got approval. They went through these steps. They were able to expedite these steps without bypassing any of them.
Correct.
Because of the situation, because of government approval, because of the influx of resources, i.e. money, and the influx of volunteers who want to do the trial. So we ended up with Moderna and Pfizer. I know there's some other ones on the horizon trying to get approval, but right now we have Moderna and Pfizer.
Yes.
Now both these companies, their vaccine is a 2-dose vaccine?
Both are 2 doses, yes.
That are 30 days apart?
Between 21 and 28 days.
Why 2 doses?
That's actually not uncommon.
Okay.
So if you think about your kids, taking your kids for their vaccinations, they get their first MMR vaccine for measles, mumps, rubella, and then a year later they get the second one. So what is happening is when you get the first vaccine, your body's immune system makes an antibody response or an immune response to it. But that immune response memory that it holds on to is on the smaller side. The second vaccine helps to boost that response. So when you get the second vaccine, your antibody response is even higher and collects more of those antibodies to be kept in case you encounter the illness. So it's not unusual to require multiple doses of a vaccine to get full protection. Very similarly, the very first time a baby gets the influenza virus, they get half of the vaccine, and then 4 weeks later, they get the second half. So it seems different because it's a 2-part vaccine we're getting in adulthood, but it's actually very common vaccine biology.
Okay, makes sense. Now, do you have some level of protection? I don't want to call immunity, but
immunity,
we'll say
yeah.
protection, immunity after the first dose.
Yes, you
and
do.
if so, how much, how long after the first dose? What is that with just the first dose?
So after the first dose, everyone's immune system is different. We're all individuals. We handle it differently. We have a different amount of robust response. But after the first vaccine, within about 14 days, there's 50 to 80% protection.
Okay. And then 21 to 28 days later, when you get the second round, the final aspect of the vaccine, what can we look at for immunity?
So after the second vaccine, again, about 14 days later, you've got to give the immune system time to respond and make that memory. Immunity is between 94 and 95% for both vaccines.
So if you get, and that's both vaccines, same deal, 94, 95% after getting 2 rounds, 21 to 28 days apart.
Yes.
So I just got my second one. So in 14 days, I could be 94, 95% immune.
Absolutely.
So I don't need to wear a mask anymore, right?
That's not true.
And why is that?
Well, what the vaccine does is it mounts a quick response if you were to be exposed to coronavirus, okay? Which means you shouldn't get sick, or if you do get sick, it'll be very mild. But also know that that means that you can still transmit it to others. So even though you may not get sick yourself, you can still pass the virus on, we believe. And of course, this is a newer vaccine, so this will be studied as time goes on. But the thought is you can still transmit the virus to others. So still wear a mask, still keep your distance, keep your hands clean.
So it almost feels like, well, why get the vaccine? If I just wear a mask, if I can get it anyways. In my mind, I equate it to having a car with airbags. I still wear my seatbelt.
Correct.
Just because I have an airbag doesn't mean I'm not going to wear my seatbelt. It's just an added level of protection.
Yes.
So me caring about the people in my lives, I went ahead and got the vaccine to make sure I don't potentially expose them to something terrible.
Absolutely.
So I've heard that there's a fear that the vaccine can give you the virus. Is that true?
No, it's not true.
And
It's
why
not
is that?
possible. Well, it's because of the way the vaccine works. So the vaccine really just teaches your body's cells to make a little tiny snippet of the protein that's on those spikes that you see on the picture of the coronavirus. It's like a spiky cell membrane. So it teaches your body's immune system to make a protein, a snippet of that spike. So your body makes that little protein, and then your immune system recognizes that protein. But there's never a point when your body is able to make a fully functioning infectious virus that can make you sick. So it's impossible.
Okay.
But you can get sick between dose 1 and dose 2. So remember, there's those 2 weeks that you have to allow time for your body's immune system to do what it's supposed to do, because your protection is not until it's done so.
So if someone came to you and said, hey, I got my first dose yesterday, I've got a fever of 102 today, you're saying vaccine didn't do it, you probably already had it.
Oh, absolutely.
So there is no actual virus in the vaccine.
There's no virus in the vaccine.
Now, in other vaccines, are there strains of virus?
There are. There are other vaccines where there are inactivated virus particles, but that is not the case with this one.
And not with, and when I said other vaccines, I don't mean for COVID-19. I mean
Correct.
influenza, everything else like that. With COVID-19, it is not, there is no strain of the virus in there. That's where you're getting the mRNA.
Correct.
All right. Now I hear this mRNA may alter your DNA.
Well,
Is it because RNA sounds so close to DNA?
I think
Is
so.
that why that jump's being made?
I think that's why the jump's being made, and it's understandable. So what mRNA is, and I heard this explained so beautifully the other day, so I'm going to try to do it the same way. mRNA is what's called messenger RNA. So it is a message that the vaccine is giving to your cells to use your own cell's ability to make proteins from messages that we normally receive. So we have mRNA in our cells. That's how our cells know how to make what they're supposed to make. So the vaccine puts the mRNA into the cell. Your cell's machinery says, oh, I'm supposed to make this spike protein. Creates the spike protein from your own cell's resources. And then your body's immune system reacts to what it's already made. Now, that being said, the mRNA is like Snapchat. This is where I'm going to sound cool to the teenagers. So what that means is once that mRNA has done its job, it's sent its message, it disappears. It is broken down so easily in cells. That's one of the reasons why this vaccine has to be so cold, because it's really not a hardy piece of nucleic acid. I mean, it's really not hardy at all. So it sends its message and then it's gone. It's deleted.
So essentially teaches the cells how to fend for themselves.
Exactly.
Okay. Now you bring up the temperature of the vaccine.
Yeah.
I hear there's mercury and lead and all that in vaccines, and there are in some, and they serve as a preservative.
Correct.
So when you get a multi-dose vial of another vaccine, they put these things in there to keep everything preserved.
Correct.
Why is this vaccine so cold? Is that essentially its preservative?
Well, yes, in a way. That's a great way to think about it. So the mRNA, like I talked about, is really kind of weak. It's a wimpy thing, okay? So if it is warm, it's going to be denatured. It's going to break up. So the way that it is preserved is by keeping it so cold. That being said, when it's warmed up, you've got a shelf life. The clock starts to tick. Mm-hmm. And if you don't use the vaccine within that time frame, then it's no good. The mRNA is gone. So that's why there's no need for preservatives in these vaccines. There's no thimerosal, which many people are concerned about. There's no lead. There's no mercury. There's mRNA. There's some salt. There's some potassium chloride. There's some lipids to get it into your cell. Lipids is just fat, you know. Mm-hmm. And really, that's about it.
So the extent of the ingredients, it's just a handful of things in it?
I want to say there's about 5 ingredients, but you can get a list of the ingredients on the CDC's website.
CDC's website, okay. So no preservatives, so I don't have to worry about mercury or any of those other scary things I'm seeing on the internet. If this mRNA is going to teach my cells how to combat the spike protein on the virus, does the vaccine, is it work? Say there's, I don't know how many verified strains do we know that are out there?
Oh boy.
Do we have a number? Do we have a ballpark?
Ballpark, I think there's a handful, 5 to 7.
5 to 7. So if there's 5 to 7 strains, how can this vaccine be good on more than just one?
So it is not unusual for viruses to mutate, so which means to change, and that's why every year you have to get the influenza vaccine, because influenza is really good at mutating. It changes. So far, the way that the coronavirus vaccine is working, because it is that snippet of the spike protein, that portion of the virus has seemed to be retained throughout the different strains. So, so far, for the strains that have been identified, the current vaccines should work.
So the vaccine attacks the spike protein. It doesn't attack the actual, that round part we see with the middle, you know, with all the spikes. That's a technical term I came up with, the middle.
Very nice.
So since the spikes, the little scary things we see, since those have not mutated at all, the vaccine works for them.
It seems to be
Now,
working.
if those do tend to one day mutate, does the current vaccine no longer work?
There's always that chance. There's always that possibility. And so scientists are keeping an eye, and this is what they do with all communicable diseases. We'll keep an eye on the mutations and keep an eye on the efficacy or the effectiveness of the vaccine. And they can make changes to it.
Okay. Well, good. Now, since we've talked about the virus and we've talked about how the vaccine came about and why we need to do different things with the vaccine, I keep hearing about potential side effects to the vaccine. And I know it's new, so it's hard to know them all. We already talked about it can't give you COVID
Right.
because that's just not how it works. There's no strain of COVID in the vaccine. I've heard things about potentially with the spike protein, the way that the baby attaches to the uterus is spike protein, so it can lead to infertility. How accurate is it that this vaccine can lead to infertility?
Well, I will say, all of us know that the vaccine is new, so there's no way for us to know 10 years down the line what all potential side effects are there. What we do know is that there's not been a signal thus far for any severe long-term side effects. That being said, where did this infertility thing come from? So we've talked a lot about the spike protein. With pregnancy, I was going to say gestation, but with pregnancy, there's a placenta. And the way on a cellular level that the placenta inserts into the uterus is through something very similar to a spike protein. So I think what happened is there's been a theoretical jump in some minds that if you are producing a spike protein with your own cells' machineries and then you're producing an antibody against it, well then who's to say that that can't affect the spike protein similarity in a human placenta? Well, it's not been shown, and the scientists have, of course we have DNA for everything, so the DNA of the spike protein from the placenta is very different than the DNA of the spike protein for the coronavirus. So I can understand where that myth came from and how the jump was made, but there's been no scientific correlation that's been made.
So someone heard spike protein,
Yes, and made the
then they
jump.
made an irresponsible assumption. And then for some reason, where we are as a society, we're very quick to jump on these false narratives. I don't know if it's the sensationalization of it, like we like to be entertained, or if we just lack the knowledge and it's fear that's guiding this, if we're just looking for messages to come back to us to help justify how we think, even though our way of thinking may not be justified, I don't know. So I read somewhere that some people in the study got Bell's palsy from the vaccine.
True and untrue.
Okay, so explain, please.
Some people in the study, 4 out of 20,000, so if there were 40,000 people in the study, 20,000 of them got the vaccine. 4 of those 20,000 did develop Bell's palsy. However, the incidence of Bell's palsy in the general population is higher than what would have happened if it were due to the vaccine. So did people in this study get Bell's palsy? Yes, 4 of them did. Is that more likely, meaning did it happen more frequently in the vaccine group than it would have happened in the general population? No. Now, will we stop looking? No. The good thing about scientists is that they are very protective over their creations, okay, for instance. So there's ongoing surveillance to look for any signals for problems with the vaccine. So 2 ways that this is happening, one of which happens with every vaccine. Every physician is required to report any suspected adverse reaction to vaccines. Okay, so it's called the Vaccine Adverse Event Reporting System. This is not new to coronavirus vaccine, this is for every vaccine. But they also have a app that every vaccine recipient in the population, and there's been 15 million people in the United States that have been vaccinated, at least one vaccine, that you can interact with this app, and it asks you questions about your side effects. So a lot of data is still being collected, and the FDA is being very careful about watching for continued safety and efficacy of this vaccine.
Because they're not in the business of making us worse
No.
off. So with just the Bell's palsy, and I'm not trying to be so tunnel visioned about this. This is just one of the things I heard. With the amount of people that experienced Bell's palsy, with the amount of people that took the vaccine, it is impossible to say they got it from the vaccine.
Correct.
Because the natural instance, if I had just plucked 20,000 people off the street, you would have had a higher number of those people experiencing Bell's palsy than the people who got the vaccine.
Just randomly.
Perfect. Okay.
Yes.
So you hinted at long-term effects. We don't know.
Right.
So it's kind of a either or. We don't know the long-term effects of the vaccine. It's impossible to know. It's too new.
Right.
What do we know the long-term effects that you hinted at before of getting COVID-19?
Oh boy. Well, so I like what you kind of hinted at. It is at this point a risk-benefit ratio equation that we're doing on a population level. So the long-term risks of the vaccine, we don't know, but we're not seeing any reason that there should be, similarly to the influenza vaccine or the MMR vaccine or the varicella vaccine. However, there are very real risks, even if you survive COVID, to having long-term neurological disease, long-term respiratory disease. So it's on a population and personal level doing a benefit-risk ratio. Mm-hmm. And what I believe and what most physicians believe and public health workers believe is that the risk of doing nothing and getting the illness outweighs the potential risk of side effects long-term from the vaccine.
And that's what I'm seeing in my personal life with masks. There's people saying they doubt the science. You don't need to wear a mask. Mm-hmm. I err on the side of caution.
Right.
So that's why I got the vaccine. I wear a mask because if they're wrong and we don't need to wear a mask, I had to have my face sweat a little bit for a few months.
Right.
If they are right about the mask and I don't wear it and I get it myself and I give it to someone that I love, I would be devastated. So it's small sacrifices that we make as a society in order for the greater good, is the way I look at it. Mm-hmm. Okay, so Chief Jones, back to you. You yourself took the vaccine. Did you have any adverse effects you just got your second round today, correct?
That's correct.
Did you have any adverse effects from the first round?
Well, as I jokingly say, my hair continues to turn gray from the vaccine. So, but no, I've been fine. For me personally, is this a soreness to the injection site? But like Dr. Moncrief has said, these little small side effects outweigh the negatives of getting COVID. So I'll take those little numbness or soreness of the shoulder and I'll move forward from there.
Now, we've made some changes on how we think about the virus. I think you and I talked about this. We both decided to trust science. Was there a point where you were just like, I'm going to listen to what made you want to get the vaccine?
Well, going back to the trust thing, during my high school time, I used to enjoy science and biology. So when they said RNA and all that, it captured me a little bit, my little knowledge that I do have of it. But listening to professional medical doctors, especially of color, when they tell me that the science is good, that's all I need to hear, because these are professionals who dedicate their life to, especially the researchers and the scientists. This is their Super Bowl. They're loving this and they don't want to fail. And so they're ramped up and they're doing their best. And if they have created something, I know it's good. I have to have faith in that. And then especially when family members who are medical doctors, we have Dr. Moncrief here saying the same thing, I have to believe it. That's my faith in that.
All right. I agree. I believe as a society, we just need to learn to trust. And I feel we are at a point where we don't trust. In minority communities, we trust even less, rightfully so. So you made a good point there. For me, when a doctor of color, and this is not I'm gonna listen to a doctor of color more than a white doctor, but for me, it makes me more comfortable when Dr. Moncrief told me, because initially when the vaccine came out, I said, I'm gonna wait. I'm gonna wait and see what happens with everybody. And she got on me and said, no, you need to get it right away. And she explained everything she's explained today to me, and I decided to just go ahead and trust. Because I know she has my best interests at heart, so I trust. So part of me wanting to do this discussion was there's a lot of mistrust, a lot of doubt, a lot of skepticism, a lot of misinformation. So I wanted to dispel a lot of that. And we've both heard it, in our daily lives. You've heard it in your daily life. And I think people just need to educate themselves. You can still go out and do your own research. If I have questions in terms of what's in the vaccine, where do they need to go?
Well, I really liked what you said about talking to your own doctor. So I think a lot of times we can hear the talking heads on TV and we don't know those people. And, you can talk to your buddies and you don't know if they know what they're talking about. But you have a relationship with your physician. And I think that is a perfect place to start, is talk to your family doctor, or if you have a specialist because you have chronic medical conditions, ask your doctor. And I'm really happy to have these conversations with my patients. I talk about this vaccine to every patient that walks in my door. So talk to a physician that you trust. And then make sure you're getting trustworthy information. Everything that you see on Facebook or Instagram or Twitter is not necessarily trustworthy information, even if it looks like it's official. So what I know is that if you go to the FDA's website, if you go to the CDC's website, or if you go to the your local public health website, you will get more than enough information. Everything that I've talked about today is public information. We're not trying to, no one's trying to hide anything. The researchers want you to see their really innovative work. You just got to know where to go to look for it.
I like that. So you start local, start with someone you trust, your own personal doctor, and then you can go on the FDA's website. What about like Pfizer and Moderna? Do they have the ingredients and everything?
Oh, absolutely.
Save just the ingredients part. Do they have it on their websites?
They have it on their website,
Okay.
yes. Now, some people will say, well, I don't want to read their website. They're trying to sell it to you. And that's the other thing that I always fail to say. The vaccine is free of charge to the public. So if you don't have insurance, or if you're underinsured, or if you have government insurance, you can get the vaccine free of charge.
And that's another thing I've heard is, well, it's free because they want as many people to get it because they want to do X, Y, and Z to us. The way I look at it is I choose to believe they don't want us to die.
Oh, no.
Because when it comes down to it, it's money. And the more people that are sick, the fewer people that can work,
Yes.
and the economy shuts down.
Absolutely.
So if you don't believe they're doing it for your best interest, they're doing it for the interest of the economy. They need you working.
Yes.
And if you're sick, you can't work.
Yeah.
So the CDC is another good resource.
Absolutely.
When it comes to any COVID questions. Do they cover the vaccine as well there?
Yes, they do.
Okay. So maybe we look at the stuff on social media as entertainment, and we trust our scientists and doctors for our facts.
That's the way I look at it.
Okay. Well, I know we touched on this. I'm going to hit it real quick. There's a new variant out
Yeah.
of the virus, and they said it's more contagious. Is there a worse outcome associated with it?
Not so far as we can tell. More contagious means that it's just spreading more easily, can make you sick more easily, but we're not seeing that it's making people sicker.
Okay. It's just getting around faster.
Correct. Yeah.
Now, does the vaccine work on that as far as we know?
So far it does.
Because again, it goes after the spike protein and not the round thing in the middle.
Not the round thing in the middle.
See, I'm learning. Should have been a doctor. All right. Well, Chief Jones, thank you very much for coming in and being very candid with us. Thanks for running the department. You have been pushing this vaccine since it came out, and you try to tell as many people you can about it. I respect that. I appreciate that. So thank you for coming. Dr. Moncrief, thank you very much for coming out. You're not being paid by Moderna or Pfizer.
No.
But we bought her lunch. So no, we
You
didn't
did?
do that.
Yes.
So she's not getting paid to be here. She's doing this because she genuinely, I can safe to say, cares about people.
Yeah.
I know it's possible. People can still care about people. So she's here out of the kindness of her heart. Very busy person. And we appreciate you taking the time
Thank
to come
you.
down. Chief Jones, Chief Hill, thank you for letting me do this. Chief Jones, you have something else?
Yeah,
to
just
say?
one other thing. Right now, Hamilton County Public Health is asking for the community to sign up and register to become vaccinated.
Okay.
So citizens of Hamilton County, excluding Springdale, please call Springdale's Health Department. Citizens of Norwood, call Norwood's Health Department. Citizens of Cincinnati, call Cincinnati's Health Department. Everyone else, go to Hamilton County Public Health and register to be vaccinated. Like I said, the science is good. Make sure we wear the mask and we stop the spread. That's it.
So Hamilton County Public Health, unless you're in Norwood or Springdale?
Yes.
Springdale.
Yes.
Is that right? Okay. So then you go on the Hamilton County Public Health and you can sign up for the vaccine. They'll tell you where to go.
Yes, you'll be registered and they'll contact you, let you know where to go, time, dates, and everything else from there.
Okay, so it's a one-stop shop kind of deal.
That's correct.
So Hamilton County, if you live in Hamilton County, go to Hamilton County Public Health. Springdale, go to your own, and Norwood, go to your own. Sign up, register, go ahead and get your vaccine. If you have questions, we can go to the CDC, we can go to the FDA, and if you're wanting to trust the company, which I think you should, you can go to Moderna, you can go to Pfizer. Just for me, when I'm looking to find the truth about things, I try to check as many sources as possible, and I eliminate the outliers. So do your research, make yourselves comfortable. If you have questions, go to these websites, go to your CDC, go to your FDA. If you have a problem trusting the government, I don't know what to tell you. But I know personally I've had the vaccine, just got my second dose after the first dose, had some pain in the arm for a couple days, then it went away. Was a little tired the first day. Outside of that, I've been great. So keep your masks on, wash your hands, get vaccinated, and thank you too for coming out today.
Well,
Thank you for having me.